Hey guys, it's Dr. Anderson at Life Essentials Chiropractic in Missouri City. So today I want to talk to you about some red flags to be aware of if you start hearing some stuff like this when you've been in an auto accident. So first of all is that if the treatment you're getting is only based around managing the pain and nobody's talking about how to rehabilitate your body and start to get actively treated with active therapies, which means you're physically rehabbing your body, then that could be a red flag. So I'm talking about things like only pain pills, only injections, only passive things where you just lay there and they do stimulators or stretches on you. There's nothing wrong with those things in and of themselves. Sometimes you got to do them because you're miserable and it helps you feel better. But if that's the only treatment you're getting, you're not really rehabilitating your body. You're not rehabilitating the muscle, the ligament, the disc. You're not really correcting the cause of the nerve impingement where they're doing injections, or the cause of the disc problem where they're doing the injections. If you got to do it, totally understandable, but you have to at some point get active care. That's what we do. We call it corrective chiropractic care, where we are actively treating the muscles, the ligaments, the structure, the alignment of the spine, the motion of the joints, the disc, opening up the nerves and getting the real root cause of why you have whiplash or a sprain or a strain or a disc bulge or tear or nerve compression in your arm or your leg or migraines or headaches or any of the things that you're dealing with. That's a red flag. You don't want to leave that there and be one of the people that we meet every day that 3 years later, 5 years later, 10 years later, they say, well, it all started way back when, and they might have got a little better at the time, but then they had all these other issues. Because like any health problem in your body, if you have a problem with your tooth, if you have a problem with your cholesterol, if you have a problem with your blood pressure, your heart, with cancer, with being overweight, with whatever it is, there's a health problem and we leave the cause there unaddressed and it keeps getting worse over time. 1 year later, and 3 years later, and 10 years later, it's gonna keep getting worse and you're gonna be spending more time and more effort and more money. And sometimes it's only partially fixable at that stage of the game, even though a lot of times we can still help. It's gonna be way more challenging than if we got to it right away, right? So that's a red flag. Make sure you're getting corrective therapies and treatments for the actual root cause of your problem, not just the symptoms of it. Another thing I see, unfortunately, is there's some great attorneys out there and we need attorneys. I've had patients that have had amazing attorneys fight for them and get them settlements that they never would have got and that they truly deserve. But there's also some attorneys that we unfortunately run into every month here where they do some things that technically actually are illegal, which is medical decision making, which means someone who's not a licensed healthcare provider dictating medical decision making. And sometimes it can sound like things like this, like, you have to go to our doctors. You cannot go to any doctor but our guy. But that's false. You have the right to choose any doctor that is licensed and professional that you think you'll have a great relationship and a great outcome with. Your attorney should be supportive of that, not discouraging you to go into a little group of people that all have agreed to work together. And many times that's for their interest, not for your interest. And a great attorney should be paid. They should make a lot of money because they have a really important job. If they helped you, protected you, and got you a lot of money and got your bills paid, they're entitled to their fee, and I love that. But some of the other scenarios, the only reason they're passing you to doctor to doctor to doctor, 5, 6, 7 different types, is because if you read the contract, they're gonna get 30 to 40% of that MRI bill. They're gonna get 40% of that surgery you get. They're gonna get 30 to 40% of the injections and 30 to 40% of the therapies and on and on. So to them, it's great. The more treatment you need, the better, but sometimes it's not in your best interest in certain scenarios. I'm not talking about all the attorneys. Like I said, there's some great ones, but you gotta make sure they're really fighting for you and not for their pocketbook. So we have some great ones that we recommend. There's several. If you ever need a referral, we can refer you to some great ones that are awesome. Another red flag is just the insurance company being overly aggressive, trying to intimidate you or discourage you from treatment, or telling you that this wasn't a big deal, there's no way you were hurt. They don't know that. As little as a 5-mile-an-hour car accident could potentially hurt somebody where they need treatment. So for them to have a cookie cutter approach to try to intimidate you to not get treatment because there's not that much vehicle damage, or or we'll settle right now and just give you $1,000 if you just sign all your rights away, I would recommend that you wait. And that's an area where you might want to get legal advice and see what your rights really are. But most of the time, you have the right to get the treatment you need especially if it's not your fault. If somebody else hit you, you do not have to be intimidated into just signing away all your rights. You have the right to wait, to seek information, to find out what treatment you actually really need before you sign anything. You might not know right away. Many people don't get the symptoms of being hurt until several days, sometimes a week or two after they start realizing all the things that are wrong. That's a pretty normal, documented process that is pretty standard in healthcare that everyone's aware of, which is why in most states in the country, you get up to 2 years to go back and claim on an injury because things can develop later on that you didn't even know happened due to adrenaline or they just delayed onset, right? So at the end of the day, I just want you to be empowered. You know, I'm not an attorney, so work with an attorney if you feel like you need one. Sometimes you don't need one in simple cases. That's really up to you and what you think is best and with your legal team. But I'm here to just tell you, I see people every day that get kind of sent to different places, maybe unnecessarily. I see people every day that don't get the treatment maybe they really need it, or they get intimidated away from getting it, or they just don't do anything at all because they don't want to deal with it. And you have the right to get better from an accident, and most of the time, either their insurance will cover, or if you have full coverage, even if it was your own fault, your insurance will cover, and there's ways to get the care you need. So if you want to talk about it, you need help navigating that, we'd love to meet you and just kind of help you navigate that process.